Thank you very much, Mr. Chairman, and thank you to our witnesses for testifying today. It is no secret that climate change has exacerbated the frequency of extreme weather events over the last years. And these intense weather events are only expected to become even more frequent and intense. Las Vegas, my hometown, is one of the most vulnerable cities to climate change due to its reliance on Colorado River water, the location in the warming and drying Southwest, and the prevalence of extreme heat events. Countless studies all point to the same thing. Heat waves have devastated health impacts, including respiratory illness, cognitive effects, heat stroke and exhaustion, and increased hospitalizations. Not to mention the compounded risk for people with pre-existing conditions such as heart disease or hypertension. According to the National Weather Service, heat kills more people in the United States than tornadoes, lightning, hurricanes, and floods combined. That's reality. But given that Nevada has one of the highest homelessness populations across the country, I want to better understand what this means for people inadequately housed and homeless people. Dr. Katri, in your testimony, you mentioned how high temperatures shut down your federally qualified health center. In the state of Nevada, where temperatures reach well over 100 degrees with no respite for the unhoused, how has your organization examined how to best help those exposed to high temperatures?
Yes, thank you. In fact, one of our health centers is a homeless health center, and we serve people who are unhoused and are in homeless encampments throughout Tennessee. And that has been a real area of worry for us because there is no place for people to be cool and they don't have access to water. It impacts their health because there's certain medications we cannot give them because they will become dehydrated. And so now housing status has to be integrated into every clinical decision that we make. Even if we have treatments that are effective for people, we cannot use them because it's so dangerous for people who are unhoused. So for us, it is an absolute critical issue to deal with the housing component of the climate crisis.
Thank you. Dr. Bittinger, now because of the current heat wave, we are also facing a record-setting drought in Nevada. The water levels at Lake Mead have reached its lowest point in more than 85 years. Together, Lake Mead and the Hoover Dam supply water and power to over 25 million people, not only in Nevada, but also California, Arizona, and Mexico. My state is expected to receive 8% less water than what is normally allocated, and there's no clear sense of what this will mean for my constituents' water usage and quality. As Dr. Sherman noted, the healthcare sector itself is largely responsible for contributing to pollution as well. The combination of an ongoing drought and incessant pollution pose major challenges in our quest for clean water. So if you and Dr. Schenk could say, where in the healthcare sector can we make the most obvious changes to reduce the industry's carbon footprint?
Thank you very much, Congressman. I think there are so many ways in which we can decrease our carbon footprint. Certainly decreasing, again, our energy utilization is extremely important, becoming more and more energy efficient, so overall our net usage goes down. Obviously, shifting to renewables is another key factor. I think promoting resilience in all of the other ways in which we use energy, anesthesia, gases, and their contribution have been mentioned, but promoting healthy transportation for our patients and for our workforce so that indirectly that we contribute less, promoting use of supply chain products that do not contribute to climate change are really important.
Thank you.
I'll turn the rest to Dr. Schenk. Thank you.
Thank you, and thank you for the question. Yes, you know, those figures about U.S. healthcare contributions, 8.5% most recently, partly authored by Dr. Jody Sherman, refers to all three scopes, scopes 1, 2, and 3. So scope 3 is our supply chain, our value chain. So for us, 40% of our emissions are in what we purchase. So that's beyond the energy, it's beyond our transportation, it's really what we're purchasing. For this, we need help. We need help from all actors to be more transparent, to be able to measure, to be able to make better choices about the emissions that we are then contributing through our purchasing decisions. Thank you.
Thank you so much, Mr. Chairman. I yield back.